Hi, this is Bob Vineyard with the Georgia Medicare Minute. Have you ever thought about picking a Medicare plan blindfolded? Believe it or not, there's a lot of people out there that do that. You remember when we were children and we used to play pin the tail on the donkey? And somebody would put a blindfold on you and they would spin you around and spin you around and spin you around. And then they'd put a tail with a sharp object, thumbtack, in there. And they'd say, go find the donkey and pin the tail on it. Well, there's a lot of people that approach their choice of Medicare plan, whether supplement or Advantage, and their drug plan in pretty much the same fashion. There are currently in Georgia, and this is 2018, currently in Georgia, depending on the part of the state that you're in and so forth, could be as many as 30 or so Advantage plans. About half of those are PPO, the other half are HMO, and I can assure you that most people that are looking at Advantage plans for the first time have no idea what they're looking at. The unfortunate thing is you can say the same thing for most of the agents that are pushing them. You can also say something very similar about drug plans. Again, in 2018, there are, in Georgia, there are 24 drug plans to pick from. And most individuals and most agents do not understand drug plans. It's especially true if there's a deductible in there. It's like all of a sudden people go crazy and they say, well, I don't want a plan with a deductible. It's going to cost me more. And that's because you don't understand how it works. I've got a whole video on Medicare Part D drug plan deductibles, and I do an expose kind of on some of the agents that I have encountered that just do not understand the deductible. And so rather than trying to learn about it and explain it to you, they just say, you don't want this plan over here that's got a deductible, so let's look at this other plan. Even though that other plan that does not have a deductible is going to cost you more every month in premiums, and more often than not your drug copays are going to be higher as well. And then we get into Medicare supplement plans. And everybody seems to think this is the easiest part of all. There's 10 plans out there. They're all standardized by Medicare. They're assigned letters A through N. Again, Medicare doesn't use all of the letters. This is not Sesame Street. There's some letters they don't really like, and so you're not going to find Medicare supplement plans with certain letters out there. But they say, well, okay, well, all of the F plans are identical. They all pay all of my health care cost. Yeah, kind of. For the most part, that's true. But if you just say, all right, all F plans are the same, I'll go with the one with the lowest price, or all of the G plans are the same, and I've decided I don't want F because it's overpriced, and I don't like the people who are pushing the F plan on me, I'm going to go with the G plan because I'm going to save money and I'm a smart consumer. And since they're all the same, I'm going to go with the one with the lowest price. More times than not, that's going to come back and bite you. I have several videos on how to shop for Medicare supplement plans, including one of them is called How to Shop Like a Boss. And that's one that you might want to look at. But the whole Medicare picture is confusing at best, even if you think you know what you're doing, because you've helped a parent in this, or older brother, older sister, talk to a neighbor, talk to friends, and say, oh, we just did this, and it's the greatest thing in the world. I got news for you. Most of the advice you're getting from friends and relatives is probably not the best of advice. You do just as well asking the kid that said, do you want fries with that, more times than not. But that's what I'm here for. Anytime you have questions, not to serve you fries, of course. Anytime you have questions about Medicare, just give me a call, shoot me an email. I'll be glad to help you. This is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.